For me, I love animals, of course. I think it enhances my life, and I love caring for them, and the companionship. Of course, they have unconditional love, but also it makes you feel a little bit more connected to the world.
Pets are a part of our families. When they get sick, we would do everything to make them feel better.
I had taken my 8-year-old dog in to the dental surgeon to have them look at some dental work that had been done on her previously. And while they're doing that, they do an oral exam. At that time, they found a cancerous spot under her tongue.
Dogs don't complain. They don't have mammograms and things like this that are routinely done to them. So most of the cancer that's discovered in dogs is discovered late. And so therefore the options are low.
Like humans, up to 30% of dogs get cancer. Fortunately for Penny, they found Ruta's cancer early.
It was luck. She was in for, they were checking her teeth, and they found a melanoma spot under her tongue, which they removed successfully. For me, it was worth it, because I got 5 more very, very good years with her, which was very important to me.
Wouldn't it be better if dogs never got cancer in the first place?
Now, for the first time, ASU scientist Stephen Johnston is trying a bold new approach. The world's first vaccine to prevent cancer before it ever starts.
I have approached this just simply as an inventor. There's a problem, cancer. Can I invent something to take care of it?
But the scientific status quo think it can't be done.
Why I tried and other people didn't is probably because I came from the outside. I wasn't an oncologist, I wasn't a cancer researcher. I just said, look, something should be done, we should get rid of cancer. How do we do it? I looked at it in a very logical way and said, let me look at the data that everybody says we can't do it. I looked at that data and they were wrong.
Proving them wrong has been the most difficult challenge of his career. Against all odds, Johnston's team has slowly and steadily toiled to put the pieces together. Now their new insights into cancer has them on the verge of a breakthrough.
The things that are different between tumor cells and normal cells that sort of compose his vaccine actually appear to be the same in mouse tumors and dog tumors and in human tumors, potentially in other species as well. So the fact that you can go from one species to another without fundamentally changing your vaccine really makes it potentially more powerful. And I'd have to say more believable too, that these same things keep cropping up in tumors no matter what species they're from.
What if we went into dogs first, tried this out to see if we could prevent cancer in dogs? And if it worked, it would be very convincing, since we're using the same vaccine, it'd be very convincing that it would work in people, so in terms of moving that along. An additional thing is that it would be a valuable product to prevent cancer in dogs. It would make us money. And we could use that money to finance the human clinical trials that we'd have to do.
And it has cancer experts taking note.
So what Stefan is doing, essentially, is asking a question. The question he's asking is, why do you get cancer in the first place? And if you knew the answer to that, could you prevent it?
We probably get and defeat up to 20 cancers in our lifetime. What this vaccine will do is essentially wake the body up to naturally kill cancer.
What he's doing is essentially taking tools from the immune system, which are created in the course of your responding to cancer, and aggregating them so that we maybe, just maybe, we can prevent cancer. That would be an astounding achievement.
Stefan epitomizes multidisciplinarity. He goes where the problem takes him, and if he has to learn new science to solve that problem, that's where he goes to. Most people retreat from risk. Stefan doesn't.
The vaccine is ready. It is safe. And now it needs to be tested.
We anticipate that we could run about a trial of about 700 owner-enrolled dogs. These are not research dogs. These are people bringing their dogs into this clinical trial. With 700 dogs, it would take us about 3 to 5 years, and that would cost about $5 million.
If it works in dogs, there's a good chance that it will work in people too.
I'm thrilled with the possibility of potentially being able to do something that has the ability to prevent cancer in both pets and people, rather than having to try and close the barn door once the horse has already run out.
Stefan's project, by definition, is ambitious because it's going after prevention, and if successful, would undoubtedly radically transform the way we approach cancer.
This is a very high bar, even for immunotherapy. So I think it's an experiment well worth doing, whatever the answer.
Somebody should at least try it once and see what happens.